My name is Dr. Leslie Balderas, and I'm an audiologist here at Applied Hearing Solutions. I was born and raised in Phoenix, Arizona, and I've lived here my entire life. Right now, don't plan on moving or living anywhere else. All of my family lives here, and I like Phoenix. I like the heat. I went to a K-8 school, public school, Orangewood Elementary School. And then I went to Washington High School. Then I went to Arizona State University for my bachelor's in speech and hearing science. And then I went to Arizona State again to get my Doctorate of Audiology. In my undergrad, I was exploring the research route versus the clinical route. So I decided to work in a research lab at ASU, and I published a few papers, but ultimately decided that working with patients and getting that clinical experience was definitely the route that I needed to go. So I applied 2 years later at ASU. So I started grad school in 2018. And so by the middle of my second year, we switched to virtual and online because it was COVID. I didn't get much clinical experience or rotations in pediatrics or vestib or any other. When applying to fourth years, I didn't quite know exactly what I wanted to do yet, but I decided to apply to a couple externships, and then Dr. Kristen Samuelson told me about the opportunity here at Applied Hearing Solutions, and I interviewed, and that's sort of the beginning of my journey here. I started my externship here at Applied Hearing Solutions in 2021, and I've been here ever since. What I like most about working at Applied Hearing Solutions is the meaningful impact that we all make on our patients' lives. I like that I get to provide every patient with the best care possible. I just like how we have this really collaborative team spirit here. From our front desk to the back office with our audiology assistant to our audiologist, we really have this open door policy to ask questions about specific cases and share our other experiences, and it makes a difference in the way that we treat our patients. My favorite experiences are when a husband and wife come in and I get that reassurance that, we gave them their husband back, or we gave them grandpa back, or something like that. Those are the patient experiences that really stick with me. Something that is more challenging to me is when a patient comes in and isn't ready to admit yet that they have a hearing loss and isn't able to see the impact that it's making on their friends or family. Counseling them and educating them about the hearing loss that they do have, and guiding them to a better realization that it is something that they should be treating so that we can improve their overall quality of life. It feels great when they finally come around and realize difficulties that they're having and not denying them anymore, and that when they're ready to admit that they have a hearing loss, because it makes all aspects of treatment a lot smoother, and it makes the patient feel great as well. It's a great feeling. Best practices are important because they ensure that I'm able to provide each patient with the best care possible, that I don't have to guess every time I do something. I can use a proven set of procedures that results in a higher outcome every single time we treat their hearing loss. I like that we get to use best practices here every single time we treat someone's hearing loss, because I've realized now how that's not the standard at many clinics around the world. And it's very important because it does result in better outcomes. So it's nice to be able to do things like real ear measurement or test box measures to make sure the hearing aids are actually functioning appropriately. And it's not normal to be able to do those kinds of things at lots of other clinics because of time and equipment constraints. Something that my patients might be surprised to learn about me is that I've been in Rotary for about 15 years on a club level and on a district level here in Arizona, and I currently am the program coordinator for their high school leadership camp in this state. Being part of Rotary is something that I'm very, very passionate about, something that I have a lot of knowledge and experience in as well. And so if you're around in the Rotary space, you might see me around. So when I'm not in the clinic, you can probably find me with my friends or family. You might be able to find me at a local coffee shop or learning how to play chess. I also love to travel, so I tend to always have a plane ticket booked somewhere. But you also might be able to find me watching sports. I love baseball, basketball, and football. So go Devils!